Hi, Mac fam, and happy Labor Day. I hope all of you have had a great day. And happy September 1st. Can't believe we're already in September. Um, Starting to feel like fall over here a little bit, starting to cool down some, which is nice. But today I wanted to go over a PowerPoint they did for my virtual class for the weight loss program. Just wanted to go over a few things with you all about that. Um, so, time off after surgery, 4 weeks is what it says. You may not lift slash pull slash push greater than 20 pounds for the first month post op. Um, you may go back sooner with restrictions, so just depends. Recovery, hospital stay 1 night is desirable, so you do need to stay 1 night. Anesthesia, you will feel tired for about 2 weeks after surgery. Fluid retention is possible and can have low weight loss first week. Energy levels are different for everyone. Pain minimum slash moderate. Some may not experience any pain. First week home, we will call and check on you a few days following surgery. Please keep track of fluid and protein intake. This can help identifying potential problems. 80/90 grams of protein, 48 plus ounces of fluid. May be difficult at first, but it will get easier. Don't forget you are expected to walk the day of surgery and exercise the first week after. Pain medications. They do prescribe narcotics for pain, but ideal to wean ASAP. They can cause constipation, and you can't drive if you take narcotics. Tylenol is an option. Heat for incision site discomfort. Medications such as ibuprofen, aspirin, Aleve, Motrin, a few other things may not be taken. We are protecting the stomach lining and preventing gastric ulcers. Decreasing slash stopping medications. So those people that take blood pressure medications or diabetes medications, you probably will eventually stop taking those after surgery eventually. It just depends on you and what they say. Dehydration, very easy to get dehydrated after surgery. Can be very serious. So you need to drink a lot of water. Reasons we don't drink enough: you don't feel like eating or drinking because you are sick, postnasal drip, major abdominal surgery, you are nauseous, you have a sore throat or mouth sores, smaller stomach size after surgery. So, yeah. You need to make a list of your symptoms. Check your heart rate. This is for dehydration. Think you're dehydrated? Call the office. Do not wait days to tell us you think you are dehydrated. If you get less than 48 ounces of fluid on any day in your initial post-operative period, you will be sent for IV fluids. So, post-surgery, I will definitely have to make sure I'm drinking a ton of fluids, water, stuff like that. I do usually do pretty good after surgeries to stay hydrated, but they just have to tell you this stuff. You may experience some nausea after surgery. Postnasal drip may have it, not know. Nausea slash vomiting. Treatment, there's like allergy pills. Stay high on fluid intake. Drink hot liquids. So yeah. Talks about a few other things like dumping syndrome, constipation, diarrhea. All these things are common after surgery. After weight loss surgery or bariatric surgery, I think is what it's called, where they make your stomach smaller, make sure you should be passing gas after surgery. So make sure you do that. Hair loss can also happen due to less food consumption. Usually 3 months delay on hair loss. So, that's something else that could happen. Office visits, you have to go. We must monitor your labs and progress. Always call them if you have any questions, concerns, anything, problems. Emotional help. You're going through a huge change in your life. Your emotions may be excitement, fear, disappointment, relationship changes. Don't get overwhelmed. Take one day at a time and just do what you can, what you are supposed to do. Everything else will fall into place. Who to contact with questions. So contact the office. If you have the app MyChart, a lot of times doctors will use that to communicate, like via text. You can text them, text their office, call them. You can view appointments. You can do a lot of things on MyChart. I have that app, so call the nurse line for any medication, medical, or symptom questions. For any food, beverage, weight loss questions, the dietitian. Reach out to the counselor if you feel emotional, depressed, anxious, anything like that, questions. So yeah, so that's kind of the gist of the PowerPoint. But I know that was a lot of information. But it was good. It was a good virtual session when I went. A lot of information, but very helpful. Those of you that are going through like the weight loss program or looking into bariatric surgery or having weight loss surgery, good luck to you. I wish you the best with that, whatever you decide to do. But yeah. Alrighty, if you liked the video, give it a thumbs up. Subscribe down below if you have not already. Always keep your head up, and I'll see you guys next time. Bye.